Reports show that the average cost of health services has increased by 30% in the last year. Currently, a simple consultation with a doctor now costs between 30,000 to 50,000 shillings depending on the health facility, and this is becoming increasingly difficult for low-income households to acquire health services. According to Edith Naku Jalova, the president of the Uganda Medical Association and a public health expert, medical bills skyrocketed so much during COVID-19, and she attributed the current situation to unregulated medical care services where prices are set at own will in the highly privatized economy.
Mushrooming pharmacies around major hospitals. Person will go buy that medicine and that medicine will be very expensive. Why is it expensive? More than it should have been is because this is targeted. The pharmacies are targeting the people in the hospital and they'll put their price according to what they think the price should be. The issue that I think about regarding healthcare is that we have people who are kind of unregulated. We have unregulated medical care. We try to regulate. The Ministry of Health does a good bit of it. Civil society does a good bit of it. But there's a lot of people giving whatever costs they want, whatever. We saw this in COVID. Some people were having bills of up to 90 million in 2 weeks.
According to data from the Uganda National Survey Report 2019 to 2020 by Uganda Bureau of Statistics, indicates a higher proportion, 45% of the population seeking health care from private hospitals and clinics compared to 35% from government health facilities. Dr. Lawrence Kaziwe, a gynecologist, informs about specialized treatment sought by some from private hospitals despite free services at the public hospitals.
Some people who are really feel, in this society, you already feel like you can't fit into getting that service from a public institution. You'd want to go into the private sector. You want to go and shop out doctors. Then it will become expensive to you.
Drugs which normally would cost very low prices. Exorbitantly priced in some private facilities and even some government facilities. So really we need to regulate our care and plan for it better than we are doing.
Information from the Ministry of Health indicates that it is in its final stages to provide legality on health insurance, with the country's health insurance bill soon be presented to Cabinet and Parliament, which will provide affordable and quality health services to the citizens regardless of their socio-economic status. According to Edith, this is a wise choice.
The regular Ugandan has it really difficult accessing affordable medical care. So one of the things that people have thought of, not only in this country but in other countries, is affordable insurance. There is what they call, I'm not an expert in that area, so health policy people know it better, but I know in public health that we can have medical insurance, and that medical insurance is usually given according to what you can afford. And that medical insurance, as opposed to what I heard on the radio recently, is not forced on anybody. The country can, for example, give a particular amount of money from our taxes to care for our health. So maybe 1,000, maybe 5,000 for all of us, which is basic medical care.
In Uganda, health insurance penetration is as low as less than 0.7%, whereas in Africa it is less than 2.8%, this followed by the high cost of health care. Pedson Mumbere, Smart 24 TV, Business Today.